When is it time to discuss advance directives with families? We will find out today on The Pulse as Lee Borsch, who's the Director of Care Management, comes on to discuss advance directives. Lee, what are advance directives?
Advance directives are documents that you create stating your wishes on what you would like to have done when you're no longer able to make those decisions for yourself.
I mentioned in the opening, when's a good time to do it? So when is the best time to do it?
Now is the best time. You never know when you're not able to make those decisions, and if you start now, it's an ongoing process, but it gives you time to reflect and consider what your values and beliefs and morals are, and give you time to talk to your family, friends, healthcare, or clergy, and let your wishes be known. And it can be changed. It's a living document, so it can be changed as your situation changes. If you're a teenager and write your advance directives, you're going to have a different response or group of friends and family when you're 90.
Do you need a lawyer
No.
to do these?
You don't. In fact, you can go out online and find copies of advance directives. The hospital, Salina Regional Health Center, has copies online that can be copied and given to your doctor, brought to the hospital to put in your medical records. If you ever become a patient at the hospital, we can ask if you want to do it at that time. But sometimes that's too late.
I've heard some terms, living will, durable power of attorney, do not resuscitate orders. Help us understand these a little better.
It is confusing, I agree. There's basically two things you want to do. One is a durable power of attorney for healthcare decisions.
Okay.
That document specifies who you want to have as your agent to make decisions when you no longer can do it.
Okay.
The second one is what you want for treatment. And that can have a term as a DNR, do not resuscitate. It could be a living will. It could be something more complicated. But what it says in that advance directive for treatment is what you want.
What happens when there's difference of opinion within the family?
Well, that does happen. And that's the beauty of having major durable power of attorney for healthcare decisions declared it, is that they have a legal document that says they're the ones who are making that decision. It's best if that person knows exactly what you want and has been involved with you during your whole disease process and knows your medical history, so they know what's going to happen. What we've seen at the hospital is one child is caring for an elderly parent and a sibling comes in from out of state, hasn't seen that parent for 4 years, wants everything done. They're not understanding the health condition that brought that parent to the hospital. The one that's been caring for him knows exactly because they've had conversations with that parent. And so there's oftentimes family dynamics that are very difficult to manage. If we have that document, we can say, this is the person who's making the decision.
Thank you for watching The Pulse. For more information, please visit the Advanced Directives page on srhc.com underneath the Patients and Visitors section, and like us on Facebook and follow us on Twitter.